Here now is Solutionaries.
I'm Louis Bolden, and this is Solutionaries. The goal of Solutionaries is to highlight the creative answers to problems impacting Central Florida and communities around the country. When it comes to our health, pharmaceutical drugs can improve quality of life, especially for patients in pain. The problem is these drugs can be abused, leading to addiction and, in worst cases, even death. Take fentanyl, for example. It's a powerful anesthetic. It is FDA approved for treating severe pain, and it's typically prescribed after surgery or for advanced stage cancer. But because of its potency and low cost, fentanyl is also sold on the illegal drug market and mixed with other illicit drugs. Solutionaries correspondent Victor Williams spoke to a man who survived a near-fatal overdose. He also spoke to a drug enforcement agent who says he's pushing for better access to the overdose reversal drug, Narcan.
The opioid epidemic in this country is strong, with no signs of slowing down.
Fentanyl is a synthetic opioid.
It was a very intense sensation, very intense high, and it always ended the same, me nodding out or passing out.
More on that man's stories and struggles in just a few minutes, but all it takes is 2 milligrams of fentanyl for it to be considered a lethal dose. And unfortunately, since the lab-manufactured drug is constantly sold under the guise of many others, that means that just one pill could kill.
And this is one of the key factors in combating opioid overdoses.
More on how this Narcan is becoming more accessible coming right up in just a few minutes. But here's a man who is no stranger to fentanyl at all.
I've known people and myself to pass out OD and wake up and do some more. So it's a vicious cycle. It takes over your brain.
Anthony Lisbon has been battling his addiction with the drug for quite some time.
The worst thing is when the withdrawals from it. It's terrible.
What's that like?
Your whole body hurts, spine hurts, hot, cold sweats. I have about 5 or 6 friends this year alone that have OD'd on fentanyl. I can't describe why I kept doing it, you know?
That's why he checked into Metro Detroit Rehab Center, Mariners Inn.
So I'm currently in the program. I just completed my 30-day residential.
DEA agent Dominic Brascio III says Anthony isn't the only one trying to recover from fentanyl addiction. In fact, some people have no idea they may be coming into contact with the drug to begin with.
Fentanyl's being mixed in many types of drugs. It can be found as fake prescription pills. The availability of it is something that is scary and alarming, and something we're trying to combat by targeting the Mexican drug cartels that are bringing it into the United States. Only 2 milligrams of fentanyl is considered a potentially lethal dose, and that is roughly the size of something of a few grains of sand.
Thankfully, there's Narcan, aka naloxone, the nasal spray that can bring someone back from an overdose almost immediately. Now Narcan is becoming more widely available. This Narcan vending machine in particular is at Wayne State University, and it's free of charge. Narcan will also be available in retail stores, pharmacies, and online. Stores like Walgreens, Rite Aid, and Walmart plan to carry it in every single store. The suggested price will be around $44.99 for 2 doses. The hope is that everyone can add it to their first aid kits. Here's Walgreens' chief medical officer on how accessible the life-saving drug will be.
We really don't want there to be any stigma involved. So we've made this available at the front end of the store, over the desk, but also in the back end of the store, over by the pharmacy.
Here's one problem with that solution. You don't have that much time to get help afterwards.
This only takes effect in the body for approximately 30 to 90 minutes. That means that the effects of naloxone or Narcan could wear off before the effects of the opioid that's in the body. So, in other words, it's extremely important to call medical professionals or emergency first responders even after you've administered Narcan.
While we know there is no perfect solution to these problems, at least there are a few resources in place that can help people either get off the pathway of addiction or prevent overdoses altogether. And also, with this Narcan becoming more easily accessible by the day, it's definitely something that you can take advantage of if you need it for yourself or either others. It might not be perfect, but at least it's a start.
You can learn more about where to find free Narcan in your area in this story on clickorlando.com. For decades, psychedelic drugs like MDMA and LSD have been listed as Schedule I drugs. This means under federal law, they currently have no accepted medical use and a high potential for abuse. But in recent years, the DEA has allowed some scientists to study these drugs as possible treatments for a variety of mental health conditions. Producer Katrina Scales spoke with researchers on the forefront of these experimental therapies and learned about one that could be approved by the FDA as early as next year.
When it comes to clinical research on psychedelic drugs, the U.S. has come a long way since the 1960s and 70s.
Really, that was the period when the United States started the so-called war on drugs.
America's public enemy number one in the United States is drug abuse.
It was pretty much like somebody hit the pause button on all this research.
And only until the turn of the 21st century, and more so in the last 10 years, has this research expanded rapidly.
I've been working at Johns Hopkins for the last 11 years studying psychedelics as potential treatments for a number of different health conditions.
More specifically, psilocybin.
Psilocybin is interesting, though. It's found in all these different types of mushrooms, and we know that there's a long history of use in indigenous cultures.
His work looks at how psychedelics can improve the way we treat people dealing with addiction or depression by altering a serotonin receptor in the brain.
And that causes some profound mood and mind-altering effects.
Combined with counseling and talk therapy, patients have described having profound experiences.
It's as though my brain were trying to do, 100 things at once.
Why does that work? And is it a long-term solution?
Great question. So first answer is we don't really know why this works or how it works. It's been something that's been studied for decades. Now, when we talk to people about what it is that sticks out to them about their experiences, they often talk about these experiences as being big, kind of life-altering aha moments that could be very insightful for them. It's not always that way across the board.
Right now, more work is being done with psilocybin as an aid to the treatment of depression, but FDA approval could still likely be several years away. Closer on the horizon, MDMA, also known as ecstasy, for treatment of severe post-traumatic stress disorder, PTSD.
We've been working on that project for about 6.5 years now. It's funded by a nonprofit group called the MAPS PBC.
For that, I talked to Dr. Jennifer Mitchell.
I'm a professor at UCSF in the departments of neurology and psychiatry and behavioral science, and I am also the associate chief of staff for research at the San Francisco VA Medical Center.
On September 14th, 2023, her project was published in the journal Nature Medicine.
MDMA is administered 3 times in a very specific environment with a very well-trained staff at hand, and those dosing sessions each take about 8 hours. And then in follow-up, we assess how much PTSD symptomology a participant still has.
Can you give me a summarized version of what the FDA approval process is like? Because it sounds very stringent.
Yeah, it is very stringent, right? So God bless the FDA. It's trying to keep us safe. But the idea here is that you have these different phase trials. And each phase, as the number gets bigger, you get closer to FDA submission of what we call a new drug application. The drug will soon be submitted as MDMA-assisted therapy to the FDA for evaluation. I hope that will happen before the end of this year.
Like psilocybin, MDMA was used in conjunction with cognitive behavioral therapy, and results showed participants with major psychological trauma experienced a significant reduction in PTSD symptoms versus those who received a placebo.
I mean, I know logically, third side bomb, all that stuff, I had nothing to do with. I wasn't even there.
Well, I think one of the special things about MDMA is that it really draws on self-compassion. And so when you're talking about the treatment of PTSD or perhaps even depression, it's really important to have a lot of self-compassion so that when you take a look back at your trauma, you can approach it without feelings of shame or embarrassment or detachment, which is, I think, very common.
I don't know, I feel normal again, if that makes any sense. Well, I feel mentally relaxed, how about that?
So if it is eventually approved for use, what is that use going to look like?
Right now, it will probably be administered in a medical setting or in a therapeutic treatment setting by facilitators that are very well trained and vetted.
So this isn't just about FDA, approving this as a medication, but then there's going to have to be things that happen on the back end of that.
So are psychedelics a solution? Certainly not yet. There are many unanswered questions about how these drugs could affect people with physical and mental health issues, and concerns over how easily psychedelics can be abused.
These drugs really do need to be administered with oversight. I hope that no one decides to try to do MDMA-assisted therapy alone in their living room, because I could imagine that the consequences could be quite deleterious for a lot of them.
For Solutionaries, I'm Katrina Scales.
Still ahead on Solutionaries, drugs for weight loss and why some in the medical community are worried about their popularity online.
So you have no idea what is actually in there. They're telling you it's semaglutide, but you don't really know for sure.
The benefits and side effects you should know. Next. Weight loss injectables are popular, and that's for good reason. Stephanie Paris turned to Mounjaro and lost 25 pounds in 6 months, significantly improving her quality of life and confidence. But the success did not come without complications. Solutionaries correspondent Tiffany Salome found out about the growing concern over the drug's viral status on social media.
Let's talk about weight loss. What do you do when you've tried everything? Exercising, dieting, and even other lifestyle changes, but nothing is working. Medications like Ozempic, Wegovy, and Mounjaro could be the answer. The weekly injections are delivering incredible results for patients who are struggling to shed pounds. Solutionaries is working to find everyday solutions to problems like weight loss. We're going to look at the evidence that this solution actually works and also talk about the limitations.
Stephanie Paris has been using Mounjaro for weight loss since January.
I'm Stephanie. I'm married to my husband, Jacob. We've been married for almost 5 years now, and we have a daughter who will be 4 in September.
We reached out to you, our viewers, to find out what questions you may have about the drugs, how they work, and whether or not they're working for you. Stephanie was one of many who told us the injectable medications have changed her life. Her family is always spending time outdoors, and since starting the medication, she feels more like herself.
So I've always been very small my whole life, very petite, never had a problem with weight. After I got married, I was in like the 120s, and I was, about 30 years old. But after I had my baby, I got pretty close to my pre-baby weight. But I noticed I had really, really, really bad anxiety. My confidence was, as low as it could be. Thinking of me in a bathing suit, even a one-piece, was just cringeworthy.
When did you start talking about injections like Ozempic to help you lose weight?
I saw it on social media platforms like TikTok and stuff like that, but someone I grew up with, I think she was probably like the first person that I saw a huge change in.
And you said you started in January, so what's your weight loss progress been like 6 months later?
I'm 25 pounds down. My clothes are much bigger on me, my energy levels are up, so I feel much better.
So how do the medications work, and are they safe? We went to ThinMD Med Spa in Jacksonville Beach for those answers from Dr. Anthony Capasso. He's been studying weight loss and perfecting treatment for his patients for the last 17 years. Dr. Capasso believes weight loss is personal. He offers customized weight loss plans for his patients based on their goals, and that can include weight loss shots.
There's a little difference between Mounjaro and the Wegovy or the Ozempic. So basically, it's a way of increasing the natural chemicals in your body that suppress your appetite so you don't feel like you want to eat.
Semaglutides were FDA approved for weight loss in 2021 under the brand name Wegovy. It's also available as Ozempic, which is the same medication but sold to treat type 2 diabetes. Mounjaro is slightly different. It's a tirzepatide. The injectable pen was FDA approved in 2022 as a diabetes treatment and could soon also be approved for weight loss. Dr. Capasso says it all works by mimicking a natural hormone in the body that helps regulate blood sugar, digestion, and hunger.
So is this a good solution for weight loss?
It's been one of the best solutions that I've seen in 20 years. I've had patients that I didn't ever think would lose weight and did, but it has to be monitored and it has to be done by, the people that understand that.
Dr. Capasso strongly recommends patients are monitored by a doctor when using these injectable weight loss medications because there's a risk of muscle loss, and the side effects can be intense. Some users say they've admitted themselves to the ER because of severe nausea and vomiting. One lawsuit claims that the drugs can even cause stomach paralysis. Dr. Hussein Abbas is a weight loss specialist and director of bariatric medicine at HCA Florida Memorial Hospital. He says paralysis can be caused by undiagnosed illnesses and by a patient's diabetes. He is not worried about this being a common problem.
Could these medications cause gastroparesis in the long run? There's no data to suggest that right now. Unless there's something that's unpublished and I'm unaware of, these have definitely not been published so far.
Catherine Jevaleva, a pharmacist practitioner at UF Health Jacksonville, agrees. We took your questions to her about the potential downfalls of using the injections and whether the drugs are a long-term solution. There's also concerns about buying the drugs online or on social media.
So what are the side effects of using these drugs for weight loss?
Stomach side effects. So you'll see lots of nausea leading to vomiting, heartburn, acid reflux. So these medications are usually started at a very low dose to get your body used to it, and then they're titrated up slowly to make sure that you're tolerating the medication well.
People are seeing things online, on social media, and even getting targeted ads for using these drugs for weight loss. So the question is it safe? I mean, especially when you're getting it online through God knows who.
They're actually not giving you a prescription. They're giving you their own made semaglutide or liraglutide. So they're getting the actual compound and making it themselves. So you have no idea what is actually in there. They're telling you it's semaglutide, but you don't really know for sure.
Do we know enough about the long-term side effects of using these drugs for weight loss?
I think with all of these medications, you have to stay on it to maintain the weight loss.
So it's not a long-term solution?
At this time, I'm not too sure, but it seems like not really.
But you can use it as a kickstart to your weight loss, right?
Yes.
And changing your habits will help those results, kind of stay more long-term.
Exactly. So lowered portions, knowing when to stop eating. But with Wegovy and Saxenda, you'll just eat less because of that increased satiety.
So what should you do if you want to start using these drugs for weight loss? Number 1, see a doctor. This can be your primary care physician or a doctor at a med spa, like Dr. Capasso. You should also get your blood work done. This is crucial to ensuring you can safely use the injections without placing any extra stress on your body. And follow up regularly. See your doctor once a month to monitor your weight loss and adjust your dosage as needed to optimize your results. You should also call your insurance. Some insurance companies will cover the cost of these weight loss drugs, but if they don't, things can get expensive fast. So be prepared for that.
What does the out-of-pocket cost look like for your patients?
It depends. I have some patients that they get to use the coupon. I don't know how, but they do, and they'll pay like $200 or $300. But if you pay without the coupon, it's thousands of dollars a month. And I think what makes this so life-changing is if you look at the history of the other weight loss drugs available, their weight loss was pretty small. It was about 5-6 pounds, and now these drugs have come and people are losing 15% of their body weight. I mean, that's pretty huge. And so I think that's probably where this popularity came in, because it's pretty much revolutionized weight loss drugs.
Back to Stephanie. She plans to continue using Mounjaro to achieve her weight loss goals. For her, the side effects and the costs associated with the medications are manageable and worth it.
Would you recommend someone else who's struggling to lose weight try this?
100%, yes.
People call it the easy way out.
It's actually not the easy way out because there's a lot of side effects that come along with it. But when you're really struggling with your weight and you can't succeed another way, like I tried for 3 years solid to lose weight and it just wasn't working.
This has bettered your life.
Yes, 100%, yeah.
For Solutionaries, I'm Tiffany Salome.
On Solutionaries, we are always looking for solutions to life's toughest problems. You can explore all the topics covered on this show right now on the new 6 Plus app for your smart TV. I'm Louis Bolden. Thanks for watching.